Thanks, Sue. Good afternoon, everybody. This is going to take, I guess, a slightly different turn. So I'll just launch in and talk, and you'll ask questions. The thing that you have to know when you get a question, when Sue invited me, I thought, oh, really? Are you sure? I'm not sure how the work fits in the science context, but I'm beginning to get a picture here, so we'll talk about that. And the first thing you have to understand is that nobody's a clean slate. So nobody's going to hear a message about sugar without coming to that message with what's already in their head and what their culture has inundated them with over time. And from a public health perspective, it's pretty clear what that message is that they come with. This is a cover of the New Yorker, and you can see here that we have in public health put people in stocks for smoking, salt, and carbs. This is kind of an older cover from 2011. It could be sugar next. So that's how the message is going to be received. We are seen as scolds. And that is reinforced by the underlying ethic in U.S. culture about rugged individualism. We are responsible for our health ultimately. If it's kids, parents are responsible for their health. That's the starting point. And everything we know from the public health literature about how much environments have impacts on population health is just not widely known or understood, and it's very hard for people to explain. So that's the first problem we have when we're messaging about sugar or anything else. The conversation we're having here is way, way deep. And when we talk to the general public or even lawmakers or other people who are interested, it's going to have to start at a different starting point. So that's problem number one. Problem number two is that the industry, with a few exceptions, is a very loud voice with an entirely other message here that also reinforces individualism. This is a photograph that Leslie Mickelson of Prevention Institute took at SeaTac, the airport. And you can see here that the water fountain, if you can even see it, is completely obliterated. Some of you didn't even notice, I can tell by the reaction. That's a water fountain that is completely surrounded by an advertising for a very enticing sugary beverage. And we expect people to withstand this because they are individuals, and that's what we entrust them with, their health. And so if we really want them to be able to act on what's good for them, we have to pay attention to the environment. And in this kind of atmosphere in public health, we simply don't have the resources to counter this. We simply don't have it. I mean, Kelly's talked well about that in the past. So then the question is, how does this apply to sugar? And some of our most recent interests and data at Berkeley Media Studies Group has been analyzing the soda tax campaigns that Pat referred to earlier. And as I said before, the soda tax campaigns are also inundated with messages that come from an industry with a lot of money to spend that is very good at exploiting local concerns. So besides all the messages that Pat talked about, when you go into each of the communities, you see that they take advantage of what's going on locally. And this is a billboard from the tax campaign, a failed tax campaign in Richmond, California, that you can see takes advantage of the values sentiment about what's fair and unfair. They're always going to go to values, as we should too. We in public health aren't quite as good as we should be in talking about values. And they were taking advantage there of a lot of racial division in that town that has been there for quite some time. In Berkeley, what we saw, this is a campaign poster for Berkeley that many of you probably are familiar with, and our news analysis there, as in other places, shows that when the campaign is getting underway and gets on the ballot, and then right before the election, we see a real uptick in the number of stories about soda. And it becomes quite an effective education campaign. And typically, I'm not going to put too much stock in education campaigns. We just don't have much evidence that they have any effect on behavior at all. They're pretty much That was maybe overstated. They have little effect on behavior at a population level. They have some effect with people who have the resources and the initiative, but unfortunately that doesn't really get us at a population effect. So in the news media, what you have is not advertising, but news discussion that has much more credibility and legitimacy and an ongoing debate about what this thing is and why is it harmful and what should we do about it. That puts the discussion actually in a good place to be. So I'm an advocate for media advocacy, having this discussion in the context of news and policy debate, as opposed to what we saw on the first slide at public health as a scold. And in the Berkeley campaign, we saw something that we hadn't seen in some of the other campaigns, and that was quite a range of supporters of spokespeople. So there were community members, there were young people, there were policymakers, there were a whole range of people that we hadn't seen in other campaigns. And that's because Berkeley had done its homework. So Berkeley did a lot of learning from what happened in other parts of California, including Richmond. They did their community organizing ahead of time. They had leadership from a diverse number of communities across Berkeley, African American and Latino leadership in the campaign, which translated much differently than the campaign had in Berkeley and, in Richmond. And so the basic message there is that it takes more than a message. The news media is really an important amplifier and accelerator, but you have to have that background in the community organizing. You have to know what you want and how to ask for it. So there are no magic words here in terms of a message. You have to do the groundwork first. Now, campaigns might help you do that in some ways. This is that disgusting, I have to say, video from New York City, where what you see the guy right there, he's drinking fat. Oh, it's just kind of really gross. Okay, so this is a new, and it gets that reaction, and it breaks through because of that. It has an emotional reaction. By itself, I wouldn't expect much behavior change from this. But when New York City is trying to do things like change portion sizes and also trying to institute other policies, then a message like that becomes air cover for ground troops. It means the people who are the decision makers who need to move on the policy are getting a message that helps make that policy make sense. Because when we live in a community that is primarily focused on helping individuals make individual choices, the policies simply don't make sense. They want people to understand, we want people to understand that the environment matters, and so we have to have a variety of ways to let them know that it does. And one of the ways we have is by talking about what we're doing and what is happening and how interesting and exciting this is. And this is a map from 2016 of the places around the world where soda taxes are starting to be introduced, and some have there's only a few that have finally made it, but this is really important. My analogy for this is pebbles in the water. There was I'll just tell you a quick story that when Patterson was governor of New York, the legislature there passed $1 a pack excise tax on cigarettes, and in the same legislative session refused to put a few pennies on soda. And I'm thinking to myself, why? Why would the exact same legislature slap $1 a pack on cigarettes, but refuse a few pennies on soda? And my explanation to myself is that after more than 50 years now, we in public health have been throwing pebbles in the policy waters of tobacco and can now just walk right across. And with soda and now sugar, we're just starting to say what's important and what those policies are, and those pebbles are sinking right to the bottom. But we need to keep doing it. And as we talk about doing it and show the evidence of it, then people understand what's going on and they want to be on the winning side. And that's very clear from research. So touting what happens and what we're doing becomes enormously important. And then we can go from a situation like this, which comes from news coverage from Sue Babby's study in 2009, where we have a young boy admiring a vending machine full of soda. And one day, I think if we continue on this path, it will look as horrifying as this photo. And then we'll know we've really come a long way. It takes time, but I think we can do it. So I'll stop there and see if there are any questions. Yes, sir.
What effect do news stories, litigation, sugar, labeling, or otherwise have for social media impact?
Stories about litigation? I don't know of studies that examine that specifically, but I'll tell you in San Francisco, we have a warning label discussion going on right now in the litigation around that, putting warning labels on soda and advertising for soda. And what that means is that in every single news story, they have to say, warning, this is going to cause diabetes and tooth decay. And that's important. To Kristen's point earlier, we didn't, in our news coverage of Berkeley and other places, we saw very little on tooth decay and people understanding that health problem. So I think that it's valuable in that you have to say why. Why does this policy matter? So it's not that we have to have education campaigns and educate people and then go to the policy. And that's certainly not how it happened in tobacco. It happened simultaneously. The laws for clean indoor air came first, and Duluth, Minnesota was one of the first places. And when people are talking about it and talking to reporters about it, somebody has to say, well, why? Why this policy? And the answer is part of the education that goes across the whole population. And I think Carter's got some interesting data from Vermont, where they tested, I'm just going to, tell me if I say it wrong, Carter, where they did some public opinion polling before and after the soda tax measure there, which failed. But the interesting thing is that fewer people reported drinking soda after the tax, after the election. And Carter's going to correct me here in a second.
No, I would just weigh in to say we don't believe the data is accurate.
Right, that was my next sentence.
So what the data showed was a 50% self-reported decline in consumption of sugary drinks. We don't think that data is accurate, but the idea that it stigmatized the product enough that people would lie to a pollster about it, I think is a win.
Absolutely. Absolutely. It's another pebble in the water, and I think it goes to what Maris was saying about social norms. And I forgot to, I brought this up because I'll just tell you what it is. And the things that we can expect the opponents of the policies we think will make a difference will say are easy to predict. And we've seen the same arguments come from all kinds of different industries that we have focused on in public health: alcohol, tobacco, guns, toys, now sugar. And so at Berkeley Media Studies Group, we have a bingo card, and on one side is what we say, and on the other side is what they say. And we'll give anyone a free t-shirt if you take a bingo card and just fill out one square and find a quote in the newspaper that is an example of the square. We'll be happy to send you a t-shirt. So if you want the bingo card, just come see me.